It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Robin Rutherford.
Welcome back. Teeth implants have really evolved over the years and can be a great permanent option for many people. In today's Art of Dentistry, Dr. Robin Rutherford is here to explain what implants are and the process of getting them. Dr. Rutherford, thanks for being with us.
Hi there.
So first, tell us about how this has kind of evolved over the years.
Okay, I'm going to show you there's 3 ways that you can replace missing teeth.
Okay.
Now the oldest way is a removable partial denture. And people who have partials, like on the picture there, know what I'm talking about.
Right.
It's metal and plastic, the teeth are plastic, the metal is there, and like this one is an upper that fits on the roof of their mouth, and it has the little clips on both sides that clip onto the teeth that you do have. Now, that was the old way.
Okay.
And nobody likes their partial.
Right.
A lot of people have partials and they wear them, but a lot of people have partials and they say, oh, I paid money for that thing, but it's in the drawer back home somewhere.
Right.
I hate that thing,
Right, it's
okay?
uncomfortable.
So that's one way, but that's kind of like, you know, George Washington type of stuff. The second way is with a permanent type bridge, not a removable thing like the other deal was. A permanent bridge is when you have a tooth that is missing, or even a couple of teeth, but you have a tooth on both sides of the space. And this photo here shows, like my example, you have a tooth that is missing. The second picture shows what we have to do is to prepare to shape the 2 teeth next door for crowns.
Okay.
And what a bridge is, it's the 2 crowns with the false tooth between them. And it's all one unit so that you can see, you know, like this is a model in my hand, but it's all one thing that cements onto those 2 teeth. And so the next photo shows just what it kind of looks like. So that's why it's called a bridge, because it attaches on both sides and kind of goes over the creek there.
Right.
Now, the good thing about a partial, I guess, is that it's probably inexpensive, but that's about the only good thing. The bad thing is that everyone hates their partials and they feel like they threw their money away most of the time. The good thing about a bridge is you have in fact replaced your tooth with a permanent solution.
Right.
So not a removable deal. Now the bad thing about it is, see, there's always like a little gap underneath. They try to make the false tooth fit right against the gums as if it were a real tooth, where it looks real and etc. But they always tell me, people tell me that food gets under there and it always kind of like smells like whatever they ate last. And so it's kind of nasty. And instead of being able to floss individual teeth, floss, 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 you have to put the floss underneath there and pull it out the other side and clean along underneath and then pull it back. And so it's a lot harder to keep clean. Okay, so now up until about 20 years ago, those were the 2 ways that there were. Nowadays we have implants. Now here's a picture that shows my scenario. You're missing a tooth, and here's where we have placed the implant. The implant is made of titanium, which is metal, but it's a type of metal that your body likes. Nobody rejects titanium or is allergic to titanium or anything. But the root of the tooth is the implant. It's equal to the root. And then you put a crown on the top. And so you have your tooth. And so from the outside, it looks like a tooth and it feels like a tooth.
Wow.
And in fact, see, it's individual teeth. So you can floss, you can brush, nothing catches in between. People that have implants consistently, I ask my patients, so how have they done for you? Are you glad you did it? And they're going, oh, yes. You know, and they can eat corn on the cob, they can eat steak, they can eat whatever they want to. It's not a removable thing and it's easy to clean. It's just like having your own tooth back, like a miracle.
And the procedure to get an implant, not that hard, pretty easy?
Not at all. When I place implants, I do things like this myself. I don't have to send you to a specialist or something. And I've placed implants. In fact, I placed 7 implants in the last 2 days. I do a bunch of it, but replacing it is easy. It usually takes, I don't know, 15 minutes, maybe 30 minutes or something, not very long. We can do it with sedation if you like, where you can just sleep through the whole thing. People like that idea. I didn't even have to be there, you know, for my dental stuff. It's not very sore afterwards. Usually you take a Tylenol or an Advil or something, and it's a little sore for 1 day or 2. And so people always tell me, oh, that they've all had the experience of having a tooth pulled. That's why they're missing a tooth. And what people say is, well, it wasn't even as sore as when they pulled the tooth. So obviously that's meaning not very sore.
Yeah, so it pays off in the long run.
So this is the modern way of doing it. Sometimes a bridge is still the way it needs to be done. It's better. Sometimes, certain situations, but really now implants are the thing that's modern.
Okay. Well, Dr.
21st
Rutherford,
century.
thank you so much for being
Dr. Robin Rutherford.